Hi there, this is Chris Reese coming at you from the Oxford Physical Therapy location in Blue Ash. Second installment with our injury prevention videos this week. Today I want to talk about a stretch, the most important stretch in my opinion for most of the modern world. You'll notice I'm sitting for this video. Most of us spend a lot of our day sitting, right? What does that mean for our muscles and our legs? The main thing we're looking at is hip flexion, right? In this position here, muscles in front of my hip, front of my thigh are shortened. And if I work at a desk or I work in a chair most of my day, these guys spend a lot of time short. If I then go show up to my 6:30 run and I want to use these in a lengthened position as I stride out and run down the road, it's going to be difficult for those muscles to get into that position. So that stretching these is one of the most important things we can do. I'll show you the proper way that I like to illustrate for patients doing this stretch. It can be done a lot of different ways. Some aren't always the best. In my opinion, this is the most important stretch. Hamstrings are a favorite, calves are a favorite. A lot of people like those, they're easy to do. This is not something you can easily do or comfortably do just anywhere, certainly in a parking lot, doesn't always work. But it's the most important one in my opinion, and I would recommend doing it at home, somewhere you can get into a more comfortable position. Okay, so for this stretch, all you need is something to lean on, and I like to put a blue pad, something soft on the floor. In the clinic we use this pad, at home, towel, pillow, anything soft to protect the front of your knee. What you're going to do is get into a kneeling position or a half kneeling position. I use the table for balance. Before I do the stretch, many of you are maybe familiar with this, you kind of the lunge, you're stretching the front of the hip. However, to do it correctly, you want to engage your abdominals first. If you're familiar with a posterior pelvic tilt, you want to think about engaging your abdominals to tuck your butt, tuck your pelvis underneath you first, and then lean forward, maintaining that contraction. That puts your pelvis in a position to maximally lengthen the muscle you're trying to stretch on the front of your hip. You'll feel this front of your hip maybe, front of your thigh. That's what you're after. So I want to show you the incorrect way to do this stretch. You may have seen this before where you have a lot of arch in the back, you have a big lean forward. This is incorrect. All you're doing is putting your back in a potentially vulnerable position with a lot of extension. You're allowing your pelvis to roll forward, which is simply shortening the muscle you're trying to stretch. Again, the core contraction is necessary to keep your body in the correct position to get the optimal stretch. I usually recommend around 30-second hold, no shorter than 30 seconds, potentially up to a minute, and maybe 2 to 4 repetitions. I like the table so you're not worrying about trying to balance while you're doing it. So maybe not the most convenient stretch, but definitely the most important in my mind for runners, and again, anybody who's spending a good chunk of their day sitting. If you'd like more information about this stretch or other ways you can kind of counteract the negative effects of sitting at your job all day, please contact Oxford. You can certainly visit our website, oxfordphysicaltherapy.com.